where we're notified if somebody's denied because of the lag time. We have no way of knowing. And are we never going to be able to put a process in place where if someone's denied, the caregiver and or sender they name can be notified as well of the denial?
That's a good question. I think we can think about doing that. I'd have to think about it from the center's perspective. I think we may be able to tell the caregiver. I'm not as sure about telling the center. And I think our original opinion has been it would be incumbent upon the patient to let know those folks who that person is using as a caregiver or a center. But I understand the concern if the patient doesn't divulge that information. So let me think about that and see what we can find within our authorities to make that happen.
All right. We've got 2 more comments, and then we're going to take a break. There's a need for a break. So,
just for clarification, is it the health department's responsibility to approve or deny, or is it their job just to review the application to make sure there aren't any whiteouts or that the doctor is in good standing and that the application is complete? Because that was my understanding of it. So if there are rules that can be put in place or some type of standard review for centers to look at to make sure there is no whiteout, no crossouts, and that the doctor is in good standing because they can pull that whiteout. I mean, is that something we can put into place? Instead of, in other words, some kind of guide for the centers to go through, because in essence, you're really not denying the application if the doctor is in good standing and the application is complete. And like,
if there's nothing on the application that would cause us to deny it, you're right. But there could be fraudulent information submitted by the patient on the application hypothetically, which would generate a denial from us. And the Constitution does require that we review and issue an approval with a card or a denial. And so I don't think revenue could do that.
No, and I understand that. And I'm asking just for clarification because I do get this question. But when you say fraudulent information, in the sense that they cannot prove their residency,
Sure.
or is that where
that's one scenario? Sure.
Okay. But with proper identification at the center level, Colorado driver's license or whatever that guide, whatever that standard is, could be implemented. I'm just trying to figure out a guide for the centers to go through instead of waiting for the health departments to get back to them. In other words, look at it. Are there cross-outs, whiteouts? Is Dr. Shackelford in good standing? What kind of guide can we put in place to kind of help them determine whether or not a patient...
And candidly, I think that's, no offense, but it's probably more suited for your rulemaking and CDPHE's rulemaking than this venue.
Okay, got
We
it.
digressed a little bit there. Back to any more comments specifically on the identification?
Parenthetically, because it's identification and denial of a card hinges on a couple of things, but I just want to know if we can get numbers from CDPHE on just what sort of substantive denials there have been, how many, and what percentage are we looking at?
Okay, let's